Welcome back to the Performance Prescription. I'm here with Matt Rapucci from Target Continuum. Matt, welcome back.
Good to be here.
All right, well, let's welcome our guest, Matt Rector. He's the Chief Business Officer at Trellis Health. Welcome to the show.
Great. Thanks for having me, Jared.
We can jump right in. So we had the chance to catch up a few weeks ago, and your healthcare career has been quite a journey. So can you tell us about a little bit about your road to Trellis Health?
Yeah, absolutely. And thanks for having me on, guys. I'm looking forward to this. So my healthcare journey, yeah, it's a little eclectic. My whole career. I grew up initially up the coast of Maine in a town called Camden. But I left, went to Boston, went to Northeastern undergraduate through their Doctor of Physical Therapy program, and did my last clinical rotation in New York City for a PT group that had traditional outpatient physical therapy practices in Midtown Manhattan and Upper East Side. But the unique thing about this group is that they also put physical therapists on site at a number of corporations. Barclays, Bank of America, Hearst. I mean, big corporations. And as I was practicing in that setting, which was one-on-one and meeting the employees where they were and creating a real benefit to the employers as well, I loved that scenario. And that led me to start working on the payment structures we had in place with those groups, adding additional partners into the mix, and eventually started pivoting over towards business development. I was splitting my time with that group, doing clinical care and biz dev, and then I had a chance to join Crossover Health as I think their first New York employee. And my sales director and I were responsible for the whole eastern half of the United States for Crossover Health, which, for those who aren't familiar, is an advanced primary care company. Actually just got merged with Premise Health since we last spoke, and had the opportunity there to really cut my teeth on business development for both on-site and near-site health centers with a multidisciplinary care team of primary care, physical medicine, behavioral health, all with a really spectacular user experience, and none of it billed to insurance, a capitated model that the employer would sponsor. That was really neat, and absolutely healthcare the way it should be delivered, and really front loading primary preventive care and expanding the breadth and depth of primary care to reduce all of the more expensive and burdensome downstream care. From there, I had an opportunity to join Mount Sinai. They were about to build a flagship, like 10,000 square foot health center in the new neighborhood of Hudson Yards in New York, that was going to be geared toward the employers in the area, but also to individuals and executives. And that was what I came on to do first, was lead their direct-to-consumer sales and marketing team, which ended up turning into what's now the Mount Sinai's concierge medicine program, which is pretty neat. And a few years into that, I took on the employer business as well, and then had the opportunity to return to my home state of Maine and do something much more similar to where my passion lies, which is trying to change the way people engage in healthcare, rather than the more concierge model, with Trellis Health. So advanced primary care, with primary care, physical therapy, behavioral health. We have a pharmacist as part of the team, health coaches, and again, a capitated model, primarily being targeted to employers to sponsor for their employees, really reduce the barriers to access, no fee for service. And then we also have a retail model out there that's available.
Can you give us just a little more color on the origins of Trellis Health and what makes it unique?
Yeah, great. Thanks for asking, because it is quite unique. There is the whole industry of direct primary care and advanced primary care, and each group seems to have its own nuances. I think what's really interesting about Trellis, and part of the reason that I was super motivated to join, is that Maine Health, the largest health system by quite a bit in the state of Maine, saw what was the current landscape of medicine and healthcare and said, okay, we are losing money on primary care. We aren't providing the type of experience to the community members that we would like. And that's shown through long wait times and maybe short appointment times and trouble even getting access to a primary care provider. And we're seeing challenges in terms of talent retention, because those clinicians who are trying to do great work and are doing great work are getting burnt out by having to accommodate such large panels to be able to at least provide some level of primary care to the community. So it wasn't really, and employers at the same time are seeing the impact of that and starting to engage more with the hospital and the health system and urgent cares and things like that. So those four different groups, individuals, the health system itself, its clinicians, and the employers in the state were all kind of suffering from the challenges of primary care and what the ripple effect of that is throughout the healthcare system. So they decided, hey, instead of trying to improve the access by popping up more of these traditional primary care settings that are not really helping our people, our staff, or our community members, let's try something drastically different. And so Trellis Health is a subsidiary of Maine Health that is looking, we're trying to do this a little bit differently, and we're not really going to be satisfied with just the one practice that we started with in Portland. But the goal is to have 8 or 9 of these practices throughout the state and pair that with a super dose of virtual capabilities to be able to expand that brick and mortar capability well beyond our walls in a very rural state and to try to capture and care for as many people that we can. And I think there's a couple different really long-term goals, one of which is if we can pull this off and show that advanced primary care can have the benefit on health outcomes and I'd say a financial model to be able to scale and be profitable or at least not a loss leader, is there an opportunity then to really transform the way Maine Health as a health system provides primary care across the board? And how do we start to partner with the several other health systems throughout the state where all of these health systems have to work together in our unique state of Maine for everyone to succeed? How do we start to actually partner with some of those maybe quote unquote competitors, even though they're not really competitors in this state? How do we work with them to help with some of those same challenges?
Yeah, that's very well said. What you brought up as far as patient access and then talent retention is something that we hear on repeat as we're talking to hospitals and healthcares around the country. I'm very excited that Trellis Health is happening up in Portland, but what are some things about Maine specifically that impact healthcare or maybe your job in particular?
Yeah, it's a great point. There's a few things here. One, the rurality, right? That can't be ignored. Even, I mean, Portland, greater Portland area, I'd say is pretty urban, and you've got like Bangor and Augusta and Lewis. You have a few city hubs, but I mean, you get 30 minutes outside of those cities, and it's already rural. So part of our design of really making sure that we are doing secure SMS engagements, phone, video, and really using tech to our advantage, especially in 2026 post-pandemic. People are pretty familiar with, even if they're not doing these things, text, phone, and video with their clinicians or their clinical team. They're used to doing it with friends and family to actually strengthen our relationships. If we incorporate those um, communication modalities into primary care, that should effectively strengthen the primary care relationship without requiring you to drive 30, 45. I mean, we have some of our members at Trellis who are hours and hours away up in Aroostook County. And so they recognize the benefit that if they can stay connected through alternative means, they can save the in-person for when they actually need it, those in-person visits. So the one is the rurality. I think we have a distinct advantage in the state. Maine has a huge ratio of direct primary care providers, so singular docs who've shrunk their panels and gone off on their own and said, look, the fee-for-service insurance world does not work for relationship-based primary care. I want to bring it back to what I learned in school, what I'd love to practice, what my patients are craving. So they've really set us up well to be able to launch an advanced primary care model that can scale and grow because they've already created a lot of that awareness throughout the public about what alternative primary care models can be. So we have them to thank, and we really do enjoy opportunities when we get to partner with those folks as well.
So you mentioned that Trellis Health isn't exactly concierge care, but more of, if I'm remembering correctly, more of a whole person healthcare. So what's one thing or a couple things you'd like everyone to understand a little bit better about whole person healthcare?
I think one of the big pieces for me, and I felt a little bit of this at crossover compared to Mount Sinai, where it really was like an advanced primary care model where you're trying to change the way people engage with healthcare versus offering some really nice perks, benefits, and services in a fee for service model that still creates transactions and fragmented care to some extent. I think the really, really neat thing about Trellis is that we're even going beyond what I had the opportunity to do in a previous advanced primary care model, which is, and a lot of it has to do with that virtual component. What does it mean to be a Trellis member? Are you part of a patient panel? Are you part of a singular providers panel? Are you part of a practices panel? Are you coming in for visits or are you having engagements? What does it mean, not just on the PCP front to be able to text and phone call and video, but what does it mean for a PT or an LCSW to be an expert within a primary care team? So yes, you may come to the PT because you've had an injury or because you want to proactively address something. You may go to the LCSW for a course of therapy, but the more exciting thing that we're looking at is what does it mean to have these assets as part of your primary care delivery? What does it mean if all of a sudden my PT is really my PCP because I've had years of chronic pain and most of the health challenges that I have are actually musculoskeletal or functional in nature? What does it mean if that pharmacist is the one who's really leading most of my care because I have a complex regimen of prescriptions in tandem with a PCP or a health coach who's helping work on some of the lifestyle changes that maybe I want to make? Part of it is having this expert team together that's really interesting. But in terms of changing the way people engage with healthcare, this requires a tremendous amount of education. You may come in thinking, look, my knee hurts. I want to come in twice a week for 6 weeks to the PT. Why aren't you letting me do that? And well, because there's a better way. You don't need twice a week for 6 weeks. And maybe you do, but there may be alternative ways that we can actually meet you where you are if there are better solutions. And how do we start to guide people to that and really get them to understand that when you have this connectivity and this continual relationship with a primary care team, there's not always that need for a distinct course of therapy or a distinct visit to address a need. It may be more that you just have that support of the team to get you the resources you need.
That makes a lot of sense, and I love the team approach. And from my experience, what we've talked about before, that it's the client, the patient is involved from a goals perspective. So it's not just my knee hurts; it's what does long term health outcomes look like for me and me and my family.
I'd love to hear the things that you end up sharing more often with younger professionals, those who you are either mentoring or working with as colleagues, the things that you kind of speak to when you're offering them insights and suggestions on how to grow in their careers and how to understand this field, how to succeed. And that might include things to avoid. I don't know, things along the way. Sometimes that's just as important.
Yeah, yeah, definitely. So a lot learned. I think as you heard my eclectic tale, the disclaimer I share with anyone that I tell that story to is there's a lot of luck and a lot of time in. And so I think, and that's true actually for a lot of my peers, my friends, I hear a lot of the same thing. And it's about being prepared when those opportunities arise where the luck and the timing happen. What have you done to make sure that you're ready to take on that change? So, but I think more importantly, the couple of things that I've learned throughout my career, one is like you pretty much take any call or any introduction. I don't know. It's always going to be the people that you get to know, that network. And I'm sure that probably resonates a bit with the other Matt as a Mainer and thinking of what I was just talking about with connections to senior leaders throughout Maine, that neighborly aspect. But it's true that network, you're responsible for your own network. And if you have opportunities to go out there and meet people, have conversations, learn something. Some of my favorite meetings lately are the ones that are in a business capacity, but have absolutely nothing to do with how Trellis can do something with this other person. It's about exploring the opportunities of what could be either on their side or my side, and just having dialogue. So I think big things set you up for success is meeting a lot of people, learning a lot of things from those people. What I pride myself on is my perseverance. That's, boy, if something's going wrong or something's bad, like you're going to get through it somehow. It may get worse before it gets better, but there's something on the other side. So the more you can kind of block out any sort of negative energy and focus on what you can control and what's available to you, I think that you try to do that as much as you can.
You had mentioned this when we spoke before, but about owning your own network and the importance of people won't be neighborly unless they know you want to be neighbors. So your network won't grow unless you initiate that. So that's really strong advice.
That's right.
I think the final question I have is, one that everyone's talking about right now. So AI and emerging technologies. What's your personal approach to keeping up with AI? And or are there any unique ways that you're using AI to enhance your work?
Well, I just made the personal switch from ChatGPT over to Claude, who I call by his French pronunciation of Claude, and my whole team makes fun of me for that. And I required all of them to switch over too. So our whole team has pretty much gone over to Claude now, and I think we've seen some really big advantages on the business side in terms of efficiency. So it's simple things like emails and workflows and putting together project plans. So just the normal things that you think of AI being effective for at work, we have definitely reaped the benefit of that. Obviously, we're here to talk about healthcare, I think, a little bit more than that. The Trellis side of things is really interesting. So we made a drastic decision toward the end of last year to unnest our IT backbone from Maine Health and get our own EMR. So we left Epic and MyChart, which is honestly a fabulous piece of software for a huge, large, complex health system with 8 hospitals and every type of specialty and all that, and that's billing fee for service and insurance. And we switched over to Elation, which is much simpler and really designed around the primary care model. And we didn't even buy the billing component for that because we weren't going to be billing. So that's kind of a neat part of it. But with that switch, it's freed us up to really explore the opportunities we might have, both from like a member portal perspective. Do you even need a member portal if you've got constant communication, if you can text things and you can have video engagement? Like, what does that start to look like if your portal becomes a little more fluid and you could almost use an AI chat function to look at your medical records or to see your upcoming appointments? What would that type of engagement look like? And we don't need to be doing this for everybody, but there is a world where we talk a lot about AI from the diagnostic standpoint or behind the scenes in healthcare. But as we've just seen recently with a number of every AI company getting involved in consumer facing healthcare platforms, what does it mean to a group like Trellis that's the provider trying to enhance the relationship or enhance the member experience or patient experience through AI? How can we use AI to actually improve that relationship? And on the back end, those same types of things. How can we create efficiencies for our pharmacist so that she's not calling around to the different pharmacies based on what insurance you have and what your prescription is to see who's got the best value? AI will do that in a split second. One big thing at Trellis is we're not shrinking the panel size. We have these collaborative care teams should be able to accommodate 1,500, 2,000 patients across them. What happens if we wanted to take on 5,000? What if we had a 5,000 patient panel across a care team? I don't know. I have my doubts about our capability to do that. But if we were pressed to it, are there solutions either behind the scenes or upfront through AI that might allow us to get there without losing any of the customer experience that we've designed so far and without losing those service levels of same day access and call coverage after hours and things like that? So we're thinking of it both on behind the scenes efficiency and then actually very much upfront in how that might benefit the interactions we have with our members.
Matt, this has been a fantastic conversation as I expected. Any final thing you'd like to say or address before we call it good for this show?
I think, well, maybe my last thought is that we share this mentality at Trellis, and I think that it's getting more and more traction as more and more evidence and research comes out to support it. That this little teeny tiny amount of spend that is primary care in the scheme of your total cost of care, if you increase that spend, primary care is going to be the thing that changes the healthcare system, period. I mean, it's a broken US healthcare system. It's all back end, it's fragmented, it's transactional. It's missing that relationship based primary care piece. And if you can really nail that and people are willing to invest in that, you can flip the whole thing around. And I think that's what we're trying to do.
And really, thanks for shining a spotlight on what Trellis Health is going through and where your successes are. But I appreciate your time today.
Yeah, same. Thank you guys so much. This was great.
You bet, Matt. Really appreciate it. Thank you.